Anytime you feel a pain or a discomfort, especially on the left side of your chest, shortness of breath, that is more than your usual shortness of breath. So these might be things you want to discuss with your doctor.
For heart health specifically, preventing risk of cardiovascular diseases or stroke maybe, you limit the amount of high sodium foods.
At the very core of our overall health is our hearts. Unfortunately, heart disease remains the leading cause of death here and around the world today. How do we really know if our hearts are healthy or not? And what can we do to keep our hearts healthy? I'm Dr. Freddy Gomez. Let's find out today on Med Talk Health Talk. We all know a well-balanced diet can keep our hearts healthy. Now, exercise can do wonders as well. Now, the list goes on and on. Now, the best person to talk about how to keep our hearts healthy is Dr. Mark Louis Del Rosario. He's an interventional cardiologist here at the Asian Hospital and Medical Center, and he's also joined by Ma'am Rox. There are a lot of ways in which a doctor as yourself can examine a heart. Now, two of the more common test to be done is a 2D echocardiogram or a 2D echo and a stress test. Let's talk about the 2D echo first, which we're set up right here to do. What is a 2D echo for, Doc Mark?
So a 2D echo or an echocardiogram is an ultrasound of the heart. So essentially, we take images of the heart and evaluate the structure and the function of the heart.
Now, how about the stress test?
Okay.
What kind of information is vital for cardiologists in a stress test?
Yeah, so a stress test naman is a test where we challenge the heart and we look at the response of the heart to a stressor. And in this particular case, we generally do or usually do a treadmill test. So we make the heart rate go up, we make the blood pressure go up, and we look at how the heart responds to that particular stress and see if it's safe or if there are any changes that happens to the heart when you reach that level of activity.
Now, Doc Mark, tandem ba yan palagi? 2D echo and a stress test?
Not usually, no. So they answer two different questions. So when you're just interested in looking at your heart's resting function, so a 2D echo would be what you need. Now, if the question is, can your heart handle stress and does your heart have blockages, then a stress test would be more appropriate.
So our viewers can get a better idea on how a 2D echocardiogram works. So let's go ahead and explain, how does a 2D echocardiogram start?
Okay, sir, first you have to lie down.
Okay.
And then put some electrodes on your chest. And then put some gel in the probe. And then on your chest. There's your heart, sir.
Ma'am Rox is taking images of the heart in a certain view. We call this the parasternal view. So as I mentioned earlier, there are two main things that we look at. One is the structure. So we look at the thickness of the heart, the size of the heart, the sizes of the different chambers of the heart, and the blood vessels attached to the heart. So all of these could have abnormalities. So we do a complete or comprehensive assessment of the structure of the heart. And then in addition, we look at the function of the heart. So we look at how strong the heart is pumping, both the left and the right sides of the heart. We look at how much blood is coming out, how blood is coming through each of the valves, because sometimes those valves can have abnormalities and the flow of blood through those valves can be abnormal.
Wow, that was fairly quick. That was painless. There was no discomfort at all. So that was a good explanation on what a 2D echocardiogram is. Now, Doc Mark, let's go ahead and go to the stress test and see what that yields naman. Now we're in another test, part of the test, which is the stress test. We're still joined by Doc Mark, and now we are joined by Nurse Jay, who will be explaining this a little bit more. But first, Doc Mark, what is the importance? What kind of information can the stress test give a doctor?
So a stress test is done whenever we want to evaluate a patient for obstruction in their heart arteries. But we also do stress testing when we want to assess our patient's functional capacity or their ability to perform physical activity.
Yeah. Now, Nurse Jay previously just put probably around 10 probes on my chest, plus this one. Now, with all these probes, what kind of information is received by the machine?
So we have a Bluetooth electrocardiogram that translates it to the machine, so we can see the level or the function of your heart in every 3 minutes or every stage of the exercise while we subject you to this exercise.
Now, is there any preparation that someone who is about to do a stress test, is there anything that you should recommend that they do?
Preparations would be at least to come in, limber at least a little bit. You'd have to come in exercise gear, definitely, that's for sure. And you have to be prepared to get a little tired, especially for those who have not been exercising for some time.
Now, Doc Mark, when
Yeah.
it comes to the stress test, what needs to be done is for the heart to be stressed and it to reach its maximum estimated heart rate.
Yeah.
Now, for some, isn't this a bad thing for the heart?
Yeah, well, that's why we do our initial screening and we do your ECG at rest and make sure there are no abnormalities when your heart is at rest. Then we always check you periodically and ask for symptoms because we don't want to push you beyond what would be more comfortable for you. But for the test to be accurate and for our interpretation of the test to be accurate, we shoot for a certain percentage of your maximum predicted heart rate. If you want to keep going, that's good. But if you are already too tired, then you can stop there and the results will be interpretable and accurate.
Okay, with that in mind, Nurse Jay, let's go ahead and start the stress test.
All right. It's first stage, first 3 minutes.
Here we're checking your ECG and periodically we'll be checking your blood pressure as we go through each stage. What we're looking for are changes in your ECG patterns as you go through the different stages. So as your heart rate increases, we should see that increase in heart rate without any corresponding abnormalities on your ECG. So that additional increase in incline will also be stressful to the heart and increase your heart rate correspondingly. So you notice even if the speed by which the treadmill increased, your heart rate seems to be responding and is starting to go up now. So we're gonna just see if this is something that's sustained and interpretable. So, but how do you feel?
I feel fine.
Feel fine.
I
You're
feel
not short of
fine.
breath, no chest pain.
None at all.
None. You're not dizzy.
I can still talk.
Yeah.
There is some definite effort compared to the earlier settings, but overall, I'm still okay.
All right. So we're ending the test now. So usually the machine will give us a summary of all the ECGs, and what we look for are changes in the ECG pattern as he exercised through the whole protocol. And just based on what I saw on the screen, it looks like it's going to be a normal test. So it looks like you're good.
So wow, that was definitely an experience. That was actually a good cardio workout. So the stress test does indeed live up to its name. It does stress out your heart and makes you work for that information. Thank you, Nurse Jay, for that.
Catch your breath
Sorry,
first.
out of breath.
Breath on that.
Thank you, Nurse Jay, for that. And thank you, Doc Mark. We'll be seeing you soon again later on in the show. A stress test is performed quite often because it's a relatively simple way to evaluate your heart. But what happens when your heart is not as healthy as it may seem? Let's welcome back Dr. Mark Louis Del Rosario, interventional cardiologist from the Asian Hospital and Medical Center, to tell us more about this. Wow, I just performed that stress test, and quite frankly, that was my first time to actually do a stress test, and was quite an experience. So thank you very much for guiding us through that. Now, I noticed a lot of things during that stress test, especially when it came to my heart, what I felt till the point of exhaustion. What does it mean, Doc Mark, when you say that someone's heart is weak?
A stress test is actually a way for us to try to detect problems in the heart. Mainly two things. Number one is, are there blockages in your heart arteries? Because normally when you exercise yourself to exhaustion, your ECG and your 2D echo will change when you do your stress test all the way to exhaustion. And the second thing is we measure your functional capacity, like how much can your heart really handle. So those are two important pieces of information that we get from a stress test. And it's important that we tell our patients for them to do it to the point where they can't do it anymore. But we do it very closely guarded by the doctor, so we make sure that it's safe for you to do that.
Now, that's a good thing that you mentioned that is closely guarded, because performing till your heart's maximum performance or till exhaustion may be daunting for some, may be intimidating, even quite scary for some. But it is closely guarded by cardiologists like yourself. The information gathered in this stress test is very vital for doctors as yourself to evaluate the heart, as you said. But what are some of the health risks that might come about with a heart that is not so healthy?
When we talk about a weak heart, no? So usually our patients tell us that they are short of breath when they exert themselves, when they go up a flight of stairs, when they walk long distances. So these are their usual complaints, or they get tired easily. So these are kind of red flags that we ask our patients, and when they have these, the next step would be to do a 2D echo or to do a stress test, okay? What are the dangers if, for example, we find that they have a weak heart? So that could be a sign that their heart has a blockage. So we have to do further testing to evaluate for that. And then when a patient has a weak heart and you ignore it or you don't pay attention and you don't treat it, it can get weaker to the point that you have what's called heart failure.
Now, Mark, what does it mean for our health naman if you give the assessment that their heart is healthy and strong?
So the information that we also get from the stress test, so negative information, of course, is important, but a normal stress test also gives us good prognostic information. What does that mean? If you get a normal stress test result, then that tells us that your chances of having a heart attack in the next few years is probably very low, and that it is probably okay for you to perform physical activity, whether it's sports or work-related physical activity. So it gives us more confidence in doing heavier physical activity without worrying about your symptoms and about your heart health.
Now, Mark, for those who have undergone or who were prescribed to do a stress test and they had very good results, meaning their chances of having a heart attack or heart failure may not be in the imminent future, how often should they come back to their doctor to have that, hopefully have that assessment again?
So there's really no definite, clear guideline. You have to do this within a certain time interval. Usually it's determined by your symptoms, like if there's any change in your symptoms, or it's determined by any increase in risk. So say, for example, all of a sudden you're diagnosed with a new medical condition that puts you at a greater risk. Then maybe you would want to reevaluate your cardiac situation at that time and repeat the stress test.
I think it's common for Filipinos, at least, to be able to sometimes not notice their symptoms right away. When it comes to the top 3 symptoms maybe for the heart, or red flags that may signal that the heart needs to be checked by a doctor or a cardiologist for that matter, what type of symptoms do people feel most commonly?
Anytime you feel a pain or a discomfort, especially on the left side of your chest, shortness of breath, that is more than your usual shortness of breath, and then easy fatigability. So these might be things you want to discuss with your doctor.
Our heart is beating since the day we're born all throughout our lives. Should people think of their hearts just like any other muscle in the body that needs constant exercise in order to be healthy?
Yeah, so our heart is a muscle. It's the strongest muscle in the body, actually. So whenever we think about heart health, we really have to do things that help maintain the health of that muscle. So you mentioned exercise. That's a key part. Physical activity is a key part in keeping your heart healthy. So the recommendation of the different cardiology societies across the globe is anywhere between 30 to 45 minutes of exercise, at least 3 to 4 times a week. So doing any cardio activity would count, no? So it could be dancing, or it could be sports that require cardio, or it could be as simple as brisk walking or jogging.
Now, Mark, could you share with us what are some of the more common causes why someone would have a weak heart?
So when a person has a weak heart, the most common reason would be the muscle is not getting enough blood flow. And so that means they may have blockages in the heart arteries. So we call that coronary artery disease or ischemic heart disease. So that's why we screen our patients for it when they have a weak heart, because that's the #1 cause of a weak heart. The second would be viral causes. So sometimes infections of the heart muscle can cause it to be weak, but usually those recover after the infection. And then the last one would be medications and toxins. So say for example, alcohol and some chemotherapy drugs can cause heart weakness. So excessive intake of alcohol should be discussed with your doctor, what is moderate and what is excessive. And then also when you're in chemotherapy, you always need the cardiologist to be there for you to screen for heart weakness.
That was a lot of very useful information. Thank you so much, interventional cardiologist Dr. Mark Louis Del Rosario, for being with us, giving us your time and sharing that
Thank you
valuable
for inviting
information.
me.
Remember, it's never too late to make a change to make your heart healthier. When we return, we'll give you more tips on how to do this. So keep it here on MedTalk Health Talk. A healthy heart means a healthy you. And taking care of your heart begins with a healthy diet. To tell us more about how to take care of our heart, we have Miss Christine Lawas. She's a clinical nutritionist dietitian from the Asian Hospital and Medical Center. What kind of diet is best when we want to focus on our heart health?
Actually, there's no single diet that actually fits every one of us. But in the context of, preventing cardiovascular diseases or heart diseases, we emphasize on including more fruits and vegetables in our diet. Of course, it also includes in high fiber diet, which you can mostly find in your whole grains, your cereals, your oatmeal. Another example would be including more healthy fats in the sense that we particularly refer to the monounsaturated fatty acids that you can find in your olive oil, in your nuts, in your seeds. Another would be, syempre, limiting yung atin pong use of salt and refined sugars as well. So it's essentially a variety of intake that promotes a healthy lifestyle rather than focusing on a single type of diet as well.
What are the absolute worst foods? Kumbaga, the foods to avoid by anyone at any stage in their health journey.
And so, as much as possible, you'd want to limit, for example, yung highly processed or ultra-processed foods. So, for heart health specifically, preventing risk of cardiovascular diseases or stroke maybe, you limit the amount of high sodium foods. Like for example, yung mga instant and convenient food items natin, your ultra-processed foods like your canned goods, instant soups, instant noodles, chips, and all the likes. So essentially, they can be part of your diet, but sana very minimal lang talaga. Kasi syempre, you'd want your diet to be of a very good quality. You promote, kumbaga, a habit of including more heart-healthy type of lifestyle as well.
Now, is there anything that should be watched out for, especially when someone is at a certain age?
At a certain age, like for example, so adults alike. Now, as much as possible, we would want to focus on controlling your portion sizes later on. Now, kumbaga, portion size matters. It matters as much as what type of food you're actually eating. Now, in a sense, let's say, controlling your portion sizes, kapag hindi natin kasi siya nagagawa, chances are excess calories or excess food items that we take in can lead to weight gain. Now, weight gain, of course, would be overweight, obesity. That can also be a risk factor for you to develop other kinds of diseases like insulin resistance that can lead to type 2 diabetes. So yun yung kailangan nating watch out for, controlling your food portion sizes. Another would be your actual weight. As much as possible, we would want to maintain a healthy weight.
Now, since we're in the topic of age, is it okay for parents of children to feed their child anything they want because bata pa naman sila eh?
Chances are, as much as possible, we would want to start at a very young age. You promote a healthy eating lifestyle habang bata ka pa. Kasi syempre, yun din yung i-adopt nila later in life when they, let's say, for kids, when they move out of the house, when they move on their own, kung kunyaring yung habitual eating pattern nila is towards a healthier, more inclusive lifestyle. chances are later in life, madi-decrease din yung risk nila to develop certain kinds of medical conditions or diseases.
Okay, so we definitely learned a lot about how to keep our hearts healthy. Do you have any advice for our viewers before we go, Tin?
And so like what I mentioned earlier, so syempre diet in itself should be tailored fit for you as much as possible. Kahit general yung recommendations natin, if you would want to have a more consistent or a more comprehensive discussion as well, you should also consult with your dietitians, with your physicians as well, so that mas holistic yung approach natin and you'd know which type of diet fits for you, especially for most people who have comorbidities na. So, kasi syempre, in the topic or in the context of heart health, sometimes at a certain age, meron na kasing lumalabas na certain medical condition. So, minsan nagbabago pa rin yung diet natin. Kaya kumbaga dapat, meron kang guidance talaga from your experts, from your nutrition experts.
Okay, very good advice. So marami talaga natutunan natin mga viewers today. Thank you so much, Ms. Christine Lawas, for joining us and sharing with us your information.
Thank you so much, Doc.
A healthy heart is central to one's overall health. Hope you learned how to take care of your heart today. I'm Dr. Freddy Gomez, and we'll see you again next time here on Med Talk Health Talk.